All right, let's talk about something big that's on the horizon for cardiovascular billing. A major shift is coming, and it all kicks in on January 1st, 2026. And I'm not talking about a few minor tweaks here and there. This is a serious overhaul of some of the most common codes you're probably using every single day. So that leads to the big question.
Is your practice actually ready for this? Because again, this is way more than just a simple update. It's going to change how you code, how you document, and how you bill for pretty much the whole shebang, from complex coronary interventions all the way to lower extremity revascularization.
So here's what we're going to cover. We'll start with the why behind this huge update. Then we'll dive deep into the new codes for complex PCI. After that, we are going to tackle the biggest change of them all, the complete transformation of LER codes. We'll also hit on some new tech codes and then wrap it all up with a really clear action plan for your practice. Okay, let's jump right in with the big picture. Why is all this happening? Well, this isn't just about shuffling paperwork around. These CPT updates are a direct reflection of how much cardiovascular care itself has evolved. It's just gotten way more complex and technologically advanced. So, go ahead and circle this date on your calendar, January 1st, 2026. That is day one. It's when this entirely new landscape for cardiovascular billing officially kicks off. The whole idea is to get everyone on the same page, using a system that truly and accurately reflects the incredible work that's being done. Look, the bottom line is the old codes just weren't cutting it anymore. They couldn't capture the complexity of modern procedures. So this update is all about a few key things. Better reflecting that complexity, making sure reporting is accurate, helping streamline your documentation, and, of course, keeping everyone in compliance. First up, let's talk about percutaneous coronary intervention, or PCI. The new codes here are all about finally capturing the nuance of those really complex procedures, the kinds of things the old system it struggled with. Take a look at this new code, 92930. This one is a big deal. It's designed specifically for those really tricky situations, like when you're placing multiple stents in totally different lesions, or when you're tackling a complex bifurcation that needs work in both the main artery and the side branch. And then we've got code 92945. This one is all about revascularizing chronic total occlusions, CTOs, but specifically when you're using both antegrade and retrograde approaches. This code finally recognizes the immense skill and resources that go into these combined approach procedures. Now, this slide really paints a picture of the consolidation that's happening. You can see a whole bunch of old codes are just being deleted. Those additional branch codes, gone. Why? Because the main codes have been updated to include the term branches. And check this out. The codes for coronary thrombolysis are being removed entirely. It's a major cleanup effort. And it's not just about those major additions and deletions. There are other important revisions you need to know about. The add-on code for mechanical thrombectomy has some new wording. The code for pharmacologically induced stress now includes the phrase "when performed," just for extra clarity, and even the very definitions of what constitutes a coronary lesion or segment have been updated. Okay, if you thought the PCI changes were a big deal, brace yourself. What's happening with lower extremity revascularization is on another level. This is, without a doubt, the single most significant overhaul in this entire 2026 update. To put it as simply as possible, the old system, all those codes from 37220 through 37235, is being completely wiped out. 16 codes, just gone. And in their place, get this, we're getting 46 brand new codes. So this isn't just a one-for-one replacement. It's a massive expansion. It's designed to give us much, much greater specificity. So how in the world does this new system work? Well, it's actually built on a pretty clear new logic. Interventions are now classified based on the vascular territory, and they're split into two main buckets you see here: straightforward for stenosis and complex for occlusion. This distinction is absolutely key to accurately reporting the work you do. All right, let's switch gears for our final section. The 2026 update also does a great job of recognizing just how much technology has advanced. This part covers codes for tools that have really become the standard of care, plus some that are right on the cutting edge of cardiovascular medicine. This right here is a really significant development. Coronary plaque analysis that uses augmentative software is no longer considered experimental. Promoting it to a Category I code basically sends a huge signal that this is now an established, recognized procedure. So what does that look like in practice? Well,
The old temporary Category 3 T codes are being deleted, and they're all being replaced by this one single permanent Category I code, 75577. This really simplifies things and gives the procedure the official standing it deserves.
And the CPT book just keeps adapting to innovation. We're also seeing a whole new family of codes for autonomic nervous system devices, new remote interrogation codes for cardiac contractility modulation, and even new Category 3 codes for things like wireless IVC sensors. The future's here.
Okay, that was a lot of information. We've covered the what and the why, but now let's get to the most important part. What do you need to do to get ready? It's time to shift from just hearing about this to actually doing something about it.
Here is your game plan. It's pretty straightforward. First, get your hands on the full 2026 CPT codebook and really review these changes in detail. Second, start updating your internal documentation and billing protocols right now. Don't wait. Third, and this is so crucial, train everybody, your clinical teams and your administrative teams. And fourth, stay in the loop by subscribing to the ACC Advocate newsletter for any further updates. And for the official source of truth, for all the ongoing resources, the American College of Cardiology has got you covered. Make sure you visit acc.org/advocacy. That's where you'll get all the latest, most accurate information and support materials. And that brings us to the end. The changes are coming, and they are absolutely significant. So the final question I want to leave you with is this. How are you and your team going to adapt your workflow to seamlessly integrate these new, more precise codes into your daily practice? The time to start planning for that is right now.